Hi everyone, I am Shahan Layek. Welcome back to my channel, and we are in the middle of 100 days 100 disease series where every day I will teach you one disease. So today's topic is renal tubular acidosis, RTA. This is one of the very favorite topic for the examiner, and every time we can get a question from this. So it is very important to know about RTA, that is renal tubular acidosis. So let us know about the definition of RTA. RTA is renal tubular acidosis. It is a medical condition by which the kidney fails to excrete acid. So it is a kind of medical condition in which the kidney fails to excrete the acids. So as the kidney fails to excrete the acid, so there is an accumulation of acid in the body, and this will lead to acidosis in the body. The function of the kidney is otherwise normal. So otherwise the function of the kidney is normal, but the kidney cannot excrete the acid properly, and that is why there is an accumulation of acid in the body. This is known as renal tubular acidosis, RTA. Now basically there are four types of the RTA or renal tubular acidosis. So type 1, that is distal. Distal means it occurs in the distal tubules, that is why it is distal. Type 2 is proximal, that means it occurs in the PCT, proximal tubules. And type 3 is mixed. Mixed means it is a combination of type 1 and type 2. And type 4. Type 4 is known as hypoaldosteronism, hypokalemic RTA. So here hypoaldosteronism occurs and hyperkalemia occurs. That means increase in potassium level in the blood occurs and decrease in aldosteronism, decrease in aldosterone occurs. So these two things occurs, hypoaldosteronism and hypokalemic RTA. This is type 4. So there are four types: type 1, type 2, type 3 and type 4. Now let us learn about one by one. So first one is type 1. Type 1 is the most common type of the renal tubular acidosis. What happens in type 1? Basically I told you it occurs in the DCT, that is distal convoluted tubule. DCT generally secrete the H plus ion in the urine and make the urine acidic. But in this case, DCT cannot secrete H plus ion in the urine, and that is why you have metabolic acidosis. So what will happen to the H plus ion? This H plus ion will be accumulated in the body, and that is why you will get metabolic acidosis. Metabolic acidosis. So this is the cause of type 1. And generally it is caused, type 1 is caused due to several other diseases like Sjogren, like sickle cell anemia, like hereditary condition. All this can lead to type 1. Now how can we diagnose type 1? Basically for diagnosis of type 1, we check the pH. When the pH is greater than 5.3, that means the pH is alkaline. In case of the urine, we check the urine pH. In case of the urine pH, when we find out that it is greater than 5.3, that means alkaline urine, which is normally, which should not be normally, then we can understand that there is associated systemic acidosis associated with it. So we'll also find systemic acidosis, and we'll find that the serum bicarb level, that is bicarbonate level, also less than 20. So all these things you can understand by which we can diagnose the type 1. And for treatment of type 1, we use oral sodium bicarbonate. Soda bicarbonate, we can use sodium bicarbonate or sodium citrate. These are the two which we can use in this condition. Next is type 2. In type 2 I told you about PCT. Type 2 is the proximal one where PCT is involved. The function of PCT is to collect or reabsorb bicarbonate from the urine. This is the normal function. to collect the bicarbonate from the urine. So in this way, it helps in making the urine acidic. But in this case, this function do not occur. So failure of bicarbonate reabsorption from the urine, and this led to excessive bicarbonate in the urine. So this is known as urinary bicarbonate wasting. Urinary bicarbonate wasting, which is very, very important for the diagnosis of type 2. Urinary bicarbonate wasting. And this leads to type 2. Basically, type 2 is caused due to several diseases we can understand, like cystinosis, galactosemia, like Wilson's disease, like amyloidosis. All these can cause type 2. Now, basically, what is the treatment of type 2? In type 2 also, because as there is bicarbonate wasting, then we have to give large dose of bicarbonate. So in type 2 also, as there is large amount of bicarbonate wasting, so we will give large dose of bicarbonate. In type 3, what happens in type 3? In type 3, I told you it is a mixture of type 1 and type 2. So combination features can be found in type 3 from both type 1 and type 2. What happens in type 4? In type 4, we can get mild metabolic acidosis. Mild metabolic acidosis, which is secondary due to hypoaldosteronism. I told you about this, that first there is decrease in the aldosterone level, and secondary to it you get mild metabolic acidosis. So metabolic acidosis occurs in type 4, but it is mild, which is secondary to hypoaldosteronism. Another feature of type 4 is hyperkalemia, increase in potassium level in blood. So this also occurs in type 4. Now, what is the treatment of type 4? The treatment of type 4 is, as we have decreased aldosterone level in type 4, so we have to give aldosterone. We have to give mineralocorticoid. So mineralocorticoid, fludrocortisone is the treatment. So mineralocorticoid, fludrocortisone is given for aldosterone deficiency. So this is the end of this video. If you like this video, make a thumbs up and subscribe our channel if you are new to the channel. And please visit our playlist. We have playlist on medicine, we have playlist on pathology, we have playlist on COVID-19, we have playlist on various other topics. Please visit that. And I will ask you to visit the best medical videos. There is a playlist known as best medical videos. Watch all the videos. Watch all the videos of that playlist. You can learn a lot of diseases from this channel. Thank you so much for watching this video. Have a nice day. Bye bye.